One ophthalmologist has filed a lawsuit against a private equity, and the allegations are eye-opening. But is this an isolated case in corporate medicine or a symptom of something bigger? Dr. Charles Mayron, a retina specialist, says patient safety took a backseat to profits at Southwestern Eye Center, and when he spoke up, he got shut down. His lawsuit details concerning incidents. A patient faced treatment delays for wet AMD due to authorization issues.
Say, I want to inject this patient today. He has wet AMD, they're losing vision. You say, they'll say you can't. You need to get prior authorization. Sometimes you can get it emergently, but sometimes they'll say, no, this insurance company requires 72 hours to approve a basket. So then you're in a quandary. What do? Patient needs treatment. They're going to lose their eyesight. You're concerned if they come back and maybe they'll permanently lose something.
Another suffered permanent vision loss after a missed retinal bleed. A third went blind due to incompetent follow-up, with the involved providers later disciplined by the state board.
We have a duty to report certain things, legally and ethically. But I think as a physician, if you report, or a provider, you report, or you tell somebody, they don't really, they're not really happy to hear from you. They find it, you're an annoyance, potentially, even though you're doing what you're supposed to do.
When he reported these issues, the lawsuit claims emails vanished and complaints were dismissed as having no quality issue. In April 2024, Dr. Mayron was terminated, with his employer citing inappropriate behavior and failure to align with company values. Now, Dr. Mayron is taking his fight to the courts. Not for money, he says, but for transparency and accountability.
It's about the responsibility of the provider to live up to what is expected of them, and everybody does fail at times, but still there's an accountability of the provider or the system to know about it, make it right, try to prevent it in the future. And if you just don't hear about it, no one knows about it. It keeps happening over and over.
But is this a rogue case or a warning sign about corporate healthcare? Private equity's foothold in U.S. healthcare has grown dramatically, from owning 816 healthcare facilities in 2012 to over 5,000 in 2021, according to research. Some say it's bringing better technology and more resources for doctors. One study showed minimal impact on patient care patterns. Others suggested operational improvements. But critics warned that financial oversight can interfere with medical judgment.
As a general principle, when you're going for profit, expense has to be limited. And if your expense is necessary, either to pay employees to do their jobs properly, because they feel like they're overworked, there's not enough staffing, they just feel short-staffed, you're in a clinic, you don't have enough rooms to see patients. All these factors create a chaotic environment, and then patients suffer for that.
We reached out to the private equity firm involved, but they declined to comment. As Dr. Mayron's case unfolds, the battle between business and medicine continues. What do you think? Is private investment in healthcare a necessary evolution or a dangerous trend? I'm Diana Churung, bringing your eye care news in focus.